Hello Mr Brown, nice to see you. My name's Dr Ahmed, I'm one of the doctors here on MAU, and I'd just like to talk to you about what you've brought you in today, if that's okay.
Okay, that's fine, thank you.
All right, so I believe you've come in with collapses.
Yeah.
Tell me a little bit more about your symptoms.
It's been about a fortnight ago. I was sat watching the television in the evening, sat in an armchair, and all of a sudden I sneezed very quickly, 3 times, one after the quick succession. The next thing I remember was that I was on the floor with my wife standing over the top of me saying, "You're going to be all right." And she said that at the time I looked very pale, and a bit goggle-eyed, I think is what she said. So we didn't know what to do at the time, and so we rang the out-of-hours service, our doctor's out-of-hours service, and they said that I should be all right. It can happen to people, but recommended that I make an emergency appointment to see my GP the following day. So the following day we rang the doctor and I got in to see my GP in the afternoon, and I explained to him what happened about the sneezing, and he said that that was quite common, that it can happen to people sneezing or coughing, and that I should be all right, but to keep an eye on myself, and if anything else happened to get in touch. So that was seeing my GP. About a week after that, I was in the kitchen, I think it would be, and I was walking through from the kitchen down the hall into the lounge, and I understand that I got just inside the lounge door and just collapsed again. Just fell to the floor, and this time I was out for about 10 minutes. And when I came to, my wife was on the phone to the ambulance control people, and the ambulance was on its way. So they did a few tests at home and then put me in the back of the ambulance and then brought me up to A&E, where I was put in the resource room at A&E and then transferred to CDU. Okay,
and that's where you are now. All right, so I'd just like to ask you some more questions, if that's okay. Did you feel dizzy before any of these episodes?
No, not at all.
Okay.
No dizziness at all.
Good. What about chest pain or shortness of breath?
No, I didn't have any chest pain or shortness of breath. It was just as though the sneezing triggered the first one, and the second one was as though somebody had just pressed an off switch. No indication it was going to happen at all.
All right. And from what you're telling me, it sounds like you lost consciousness. Is that right?
Yes, completely out, yeah.
Did anyone say you were having any seizure-like movement or jerking?
No, I wasn't. I just went straight to the floor. Okay.
Bite your tongue or were incontinent?
No, not at all.
Okay. What about yourself, your general health? Have you been feeling tired lately?
No, I've been absolutely fine.
Okay, all right. No weight loss or any other symptoms?
No, none at all.
Okay, thank you. Do you get palpitations or feel your heart racing?
No.
All right. Okay. Are you on any medication at the moment?
Yes, I am on some medication. I brought a list with me, Doctor.
Oh, fantastic. Thank you. All right. So you're not on anything that would lower your heart rate there? Thank you.
Thank you.
What about illnesses? Do you have any other illnesses?
Yeah, I was diagnosed about 15 years ago with rheumatoid arthritis, but that's now managed now with tablets. And in addition to that, I had about 4 months ago a very bad case of shingles, which left me with post-herpetic neuralgia, which I'm on painkillers for at the moment.
All right. Are you anemic?
No, not at all.
Are you diabetic?
No.
Okay. Any family history of any illnesses?
No, none as such. My mother died of heart failure, but she was 84 at the time, so that's the only heart problems we've ever had in the family.
Okay, all right. Okay, I'm going to examine you now, Mr. Brown. Okay. Can I start by taking your hand? Just going to check your pulse. Okay, thank you. I'll check your blood pressure at this point, and I'll do that in a minute.
Okay.
I just want to have a listen, if that's okay, to your chest. Okay, that's fine, thank you. Just going to have a listen to the back of your chest, so just sit forward for me. Just going to lift your shirt up if that's all right. Deep breaths in and out. Thank you. I've checked the patient's pulse, listened to the front of his chest, listened to the back of his chest. I'll then go on to examine the neurological system briefly. Okay. All right, Mr. Brown, I've examined you and I've taken a history from you now, and I've seen that your medications. What I've found is that your pulse rate is quite slow, and that can certainly be a cause for you to collapse. You don't look obviously anemic, but you are on ibuprofen and cocodamol. Sometimes the ibuprofen can cause people to become anemic, so I think it's important to do some further tests. I think we need to get a full blood count.
Okay, you have 2 minutes remaining.
Check to make sure that you're not anemic. We'll also check your kidney function as well at the same time. Check your thyroid function. I know you've not been feeling especially fatigued, but it's important to check that in view of your slow pulse rate. I think we should also get an ECG to ascertain what's happening with the heart rhythm and the heart rate. We'll get a scan of your heart because I can hear a very soft murmur, which I think is probably not of any significance, but checking your heart function would be important. And then we'll take it from there. There are other tests that we could do in the future, possibly a tilt test, possibly a 24-hour monitor of your heart rhythm to decide whether or not the problem is your heart rate going too slow that's causing it to collapse. We can check your blood pressure with your lying and standing, and that'll be the next thing, although your blood pressure right now is satisfactory. Okay.
Fine, thank you.
Do you have any questions?
Yeah, I was. You're convinced it's my heart then? It's not. We were worried that it might be something wrong with my brain or a stroke or something.
I think the history that you give fits quite well with being something with a collapse due to your heart rate being very slow. Sometimes when people sneeze or cough, that can also cause them to collapse, and I do note the history of you sneezing in succession and collapsing. However, examining you today, your pulse rate is very slow. It's around 20 beats per minute.
Right.
And I think that would be enough to make you collapse. You're not on any medications that appears to be causing that. So I think it's important to have a look at your ECG. Also make sure that you're not anemic, but the history doesn't sound in keeping with a neurological problem. Certainly there's no history of any seizures, and you don't have any weakness, numbness or anything anywhere else.
Right.
That would suggest a neurological deficit or a brain neurological cause for your symptoms.
Right.
Okay.
Thank you, doctor. Thank you.
All right. Thank you.
Thank you.
That's right.
Describe any abnormal physical findings that you have identified.
Okay. I noted that Mr. Brown appeared to be bradycardic with a pulse rate in the region of 28 beats per minute. Clinically, on auscultating the precordium, there was a very soft systolic murmur heard at the left sternal edge. This didn't appear to be pathological. Lung fills were otherwise clear to auscultation. There was no evidence of any gross neurological deficit. So in summary, the main pathological finding was that the patient was grossly bradycardic at rest.
So what is your preferred diagnosis and any differential diagnosis?
And preferred diagnosis is collapse secondary to bradycardia. Differential diagnosis is collapse secondary to some degree of atrioventricular block, which would be identified on an ECG. Other possible diagnoses are another type of an arrhythmia, possibly a tachyarrhythmia, though this is less likely given that the patient denied any palpitations. And vasovagal syncope is always a possibility.
So what would be your plan for investigation of this patient going forward?
First and foremost, I'm going to start with blood tests. Exclude anemia as a possibility given that the patient was on ibuprofen and complained of collapses. It's important to exclude a significant anemia. Other things that we need to do is get an ECG, assess whether or not the patient's bradycardic simply due to a sinus bradycardia, or has he got evidence of second degree or complete heart block that might be causing to be bradycardic and collapse. Next, we could do head-up tilt tests if the previous investigations were remarkable, to see if he has a significant postural drop in his blood pressure that might be causing him to collapse. And a 24-hour tape to look for any significant brady or tachyarrhythmias, together with an echo to exclude any significant left ventricular dysfunction or valvular pathologies, though this is less likely because cardiac examination was largely unremarkable apart from the bradycardia. I think it's important to remember the drugs that patients are on can sometimes cause some of their symptoms, and given that Mr. Brown was on ibuprofen and complaining of collapses with loss of consciousness, a significant anemia could have been a cause for his symptoms, so it's important to mention this as part of your investigation, excluding anemia due to his medication. Other things to consider are that medications can sometimes cause patients to become bradycardic, so exclude the possibility of any bisoprolol or calcium channel blockers that he might be taking that may cause his symptoms. And then start with the simple investigations, always including probably full blood count using ease, moving on to an ECG, and then including the more complicated tests, 24-hour tape, an echo and tilt testing.